So this here is a very important image of the skull. So this is looking at the skull, at the head from the top view, very top view, like a bird looking down at your head. So we have looking down, we cut the head open and you remove the brain only, and this is the surface you're left with. So let me try to show you here. So if this is the head, okay, let me see, a nose, a mouth, okay, here we go, a little guy here, and we cut his head like this, and we remove this and we look down, okay. So this is what we see, and the importance of this is that it shows this is where the brain sits. So all these openings in this bone, here, 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 and over here and over there, and including here, they are the passageways for these cranial nerves to pass through this bone to go to the rest of the body, okay? Okay, so first I'll tell you that all of this area here is called the anterior cranial fossa, okay, including some of this. So from here up is the anterior cranial fossa. This is the middle cranial fossa. So the anterior cranial fossa is where you have the frontal lobe sitting. Middle cranial fossa is where here, okay, we'll include this in the middle cranial fossa. So all of this is where the temporal lobe sit, and also this is where the pituitary sits, the pituitary gland. And all of this here is the posterior cranial fossa, where the cerebellum and the occipital lobe of the brain sits. So here you can see anterior cranial fossa, middle is all here, and posterior is all here. I won't take too long on this. So here the first opening, this is called the cribriform foramen, or cribriform foramina. It's an opening that's not really a big opening like this, but rather lots of small openings. Okay, there are many small openings through which the olfactory nerves, cranial nerve 1, come up. Because we're looking from the top view, the nose is down there. Okay, see, we're looking at here, the nose is here, and the olfactory nerves come up from the nose, many of them, like this, and there's that opening, and olfactory nerves come up like that. Okay, so I hope you understand. Next, here is the optic foramen, passageway of optic nerve, which is the cranial nerve 2. Below that, there is a little process here. It is called the clinoid process. The clinoid process, under it is an opening. We can't see it here, but under this process is an opening that's called superior orbital fissure. The superior orbital fissure, remember when we talked about this orbit, the structure of the orbit? The superior orbital fissure is passageway for cranial nerves 3, 4, 6, so those are the oculomotor, trochlear, abducent, as well as V1 of the trigeminal. Then here you have the 3 openings, 1, 2, 3, and the 4th one here. Fourth one is, this is an anterior and posterior clinoid process, okay? On the close to the posterior clinoid process, there is an opening here as well. So 1, 2, 3, 4 openings. This one here is called foramen rotundum, passage of V2 of trigeminal. This one is foramen ovale, passage of V3 of foramen of trigeminal. V2, V3, V1 was here. This is foramen spinosum, not really concerned with cranial nerves. This, just lateral to the posterior clinoid process, is the foramen lacerum, passageway of internal carotid artery. And then looking down here is a big opening called the internal auditory meatus. We saw the external auditory meatus from the outside of the skull, lateral view of the skull. This is the internal auditory meatus, passageway of facial nerve 7 and vestibulocochlear 8. Then posterior to that is a big opening called jugular foramen, passageway of the internal jugular vein, as well as cranial nerves 9, 10, and 11. And cranial nerve 12 passes through the hypoglossal canal here, just lateral to the foramen magnum. It's called the hypoglossal canal, passageway of cranial nerve 12, the hypoglossal nerve. And the foramen magnum is where the entire spinal cord passes, and also site of passageway of the vertebral artery, which we did not talk about. The spinal accessory nerve may also pass through a branch of it through the foramen magnum.